The National Athletic Trainers Association developed a position statement in 2014 to present athletic trainers with information regarding pre-participation examination. The purpose was to develop recommendations on the structure and components of a thorough examination and to assist athletic trainers in identifying possible disqualifying conditions. There has been a significant rise in the number of athletes participating in structured athletics in recent years. 7.1 million high school athletes and 393,509 collegiate athletes were involved in athletics in the 2005-2006 academic year. Numbers in 2010 to 2011 have risen to 7.6 million high school and 444,077 collegiate athletes. The continued growth in athletics has also led to an increase in the risk for injury, illness, and sudden death. It is crucial that a standardized pre-participation examination is implemented to identify athletes that are at risk and manage their conditions appropriately to prevent further injury, illness, or death. There are several objectives of a pre-participation examination. Detecting life-threatening and disabling conditions is very important for the safety of the athlete. Often, athletes may not even be aware of certain conditions, therefore, they are not prepared on how to manage their conditions during athletics. Athletes that have anatomical variations, history of injury or surgery, and many other predisposing factors should also be carefully assessed to ensure that they are functionally ready to participate. These precautionary measures will also help protect an athletic trainer from possible litigation if a catastrophic or life-altering event were to take place. A pre-participation examination will also provide documentation on which athletes are eligible to participate or not, and why. If an athlete is a minor, parental consent to treat can also be obtained during the PPE, so that in an emergency, an ATC would not need to take the time to gain consent. Finally, identifying predisposing conditions can allow athletes to structure their training and rehabilitation towards their weaknesses and become a more well-rounded athlete in the long run.
Literature review and background of this position statement encompasses considerations for medical and family history, physical examination, PPE administrations, and determination of clearance. When taking the medical and family history, approximately 75% of possible problems can be identified if the history is complete. Patients should be encouraged to give a complete history regardless of what they think may or may not be important. For the physical examination, a general screening is conducted which includes vitals, a vision screening, and an examination for pulmonary, cardiovascular, genitalia for males, skin, abdominal, musculoskeletal, and neurologic systems. The purpose is to identify possible diseases or conditions that could potentially become harmful from sports participation. A major concern within sports participation is the possibility of sudden cardiac death due to pre-existing conditions. Sudden cardiac death accounts for approximately 0.5 deaths per 100,000 high school athletes each year. Some common causes of sudden cardiac death include congenital coronary artery anomalies, hypertrophic cardiomyopathy, Marfan syndrome, and myocarditis, to name a few. Potential athletes should be screened for predisposing factors for cardiovascular conditions. Unfortunately, not all predisposing factors for sudden cardiac death can be detected within the PPE due to the cost of extensive cardiovascular testing. Neurologic screening is used to find possible neurological symptoms that could threaten the athlete's health if they were to participate in sports. Athletes with a history of stingers, burners, cervical stenosis, spear-tackler spine, spinal cord injuries, seizure disorders, and concussions may require additional screening with a neurologist or team physician. Athletes should be screened for spinal and neurologic abnormalities. Neurocognitive testing should be completed as well. Orthopedic abnormalities or prior injuries can be a major disqualifier for sports participation. Knee and ankle injuries comprise a majority of prior injuries that can affect athletic performance. All prior injuries should be reported during the PPE to determine if the athlete can participate and if they require additional padding or bracing. It is recommended that the PPE be conducted 4 to 6 weeks prior to the start of a season in case there is a need to rehabilitate previous injuries, but this is not always possible. At this time, routine lab testing is not currently supported by the sports medicine community. With that being said, screening is still encouraged for anemia, sickle cell trait, diabetes mellitus, and exercise-induced bronchospasm. Any medications or supplements should be reported during the PPE. After evaluating height and weight, proper nutrition should be discussed with the athlete, especially if they are malnourished or obese or have a risk of either of these. Screening should also be conducted if the athlete is suspected to suffer from an eating disorder. Any prior heat-related illnesses should be reported. The athlete should be instructed on how to determine their hydration status and how to maintain proper hydration. With a growing trend of mental disorders among teens, the PPE should also include questions pertaining to current mental health. Depending on mental health status, the athlete may need to be referred for a mental health evaluation. Any and all information gathered during the PPE should remain confidential and comply with HIPAA and FERPA. Any information pertaining to possible allergies or chronic medical conditions should be shared, but only with appropriate personnel. This information is available to only be used in case of an emergency situation. It is recommended that the PPE be conducted 4 to 6 weeks prior to sports participation, but this is not always possible, and it is acceptable to administer 1 to 2 days prior to the start of a season. At this time, there's a standardized template for the PPE from the American Academy of Pediatrics that can be used, but it is minimal. The PPE can be administered by a physician or in a group setting. All personnel must be trained to ensure the PPE is administered properly. Administration of the PPE can be assisted by certified athletic trainers, nutritionists, physical therapists, and exercise physiologists, but is the primary responsibility of a physician. Physicians must evaluate any abnormalities or conditions that could be dangerous or affect sports participation. Ultimately, they make the determination of whether or not the athlete is cleared for participation. Team physicians and institutions can legally restrict a patient from sports participation. This decision must be individualized and be made based on data gathered from the PPE and current medical evidence. In conclusion, the PPE is designed to determine if someone is capable of participating in athletics. Everything within the PPE is there to help mitigate possible risks that could affect the health and well-being of an athlete. This has been Melissa and Anissa on the NATA position statement for PPEs. Thanks for watching.